What if diabetes was already damaging your body and you felt absolutely nothing? What if you were developing diabetes right now and didn't even know it? Millions of people have type 2 diabetes without symptoms. And today, you'll learn how to recognize the risks and how simple lifestyle changes can protect your health. Diabetes has several types. Type 1 diabetes, which is insulin dependent, type 2 diabetes, gestational diabetes, and prediabetes. Type 2 diabetes is usually diagnosed by measuring fasting blood glucose. When fasting blood sugar is higher than 125 milligrams per deciliter, it indicates diabetes. But here's the surprising part. Many people at risk feel completely normal. Several factors increase the risk of type 2 diabetes, including family history, genetics, and unhealthy lifestyle habits. Physical inactivity, obesity, poor nutrition, stress, and similar factors all play a major role. Most people with type 2 diabetes may have no symptoms at first. However, some individuals may experience excessive thirst, frequent urination, blurred vision, fatigue, or unexplained weight loss. After at least 8 hours without eating, fasting blood sugar should be between 70 and 100 milligrams per deciliter. Values between 100 and 125 are considered prediabetes, meaning the risk of developing type 2 diabetes is higher. And this is important. Blood sugar problems can exist for years before diagnosis. That's why testing matters. Another diagnostic test is the Hemoglobin A1C, which shows average blood sugar levels over the past 3 months. This test does not require fasting. An A1C value between 5.7 and 6.4 indicates prediabetes. Lower values are normal, and values higher than 6.4 indicate diabetes. The glucose tolerance test is another method. First, blood is taken while fasting. Then a sugary solution is given, and blood sugar is measured 1, 2, and 3 hours later. Less than 140 milligrams per deciliter is normal. Between 140 and 199 indicates prediabetes. 200 or more indicates diabetes. Now you might be wondering, why is early detection so important? Because uncontrolled diabetes can silently damage your body. Over time, diabetes can harm blood vessels and nerves, leading to kidney failure, heart attacks, strokes, blindness, diabetic foot ulcers, and even amputations. But here's the good news. Many of these outcomes can be prevented. Lifestyle modification is one of the most effective ways to prevent or delay diabetes. This includes regular exercise, a healthy diet, reducing sugar and saturated fats, avoiding smoking and alcohol, and keeping weight within a healthy range. Even losing 5 to 10% of body weight can help lower blood sugar levels. Reducing abdominal fat is also very important. To evaluate weight, we use body mass index, or BMI, calculated by dividing weight by height squared. A BMI between 18.5 and 25 is considered normal. 25 to 29.9 is overweight. 30 or above is obesity. Let's make this practical. What should you actually eat? People with diabetes should follow a diet that is low in calories, carbohydrates, fat, and salt, while being high in fiber. Recommended foods include leafy green vegetables, whole grains, low-fat proteins such as fish and skinless chicken, low-fat dairy products, and healthy fats like olive oil and nuts. Sugary and processed foods should be avoided. Adequate and regular sleep is also essential. Sleep deprivation increases stress hormones such as cortisol and can worsen insulin resistance. Regular medical checkups and following professional recommendations are very important. Stress management also plays a key role. Finally, regular exercise, especially moderate intensity aerobic activities such as walking, yoga, and stretching, for about 150 minutes per week has a major impact on preventing and controlling diabetes. Here's the most important message. Type 2 diabetes often develops quietly, but prevention starts with small choices you make every day. Diabetes doesn't start with symptoms. It starts with changes inside your body. The earlier you understand these changes, the more power you have to protect your health.